hear me okay as well. Do let me know if there's any problems at any point. So today we're going to be talking about the silent epidemic, which is diabetes. So particularly we're going to be speaking about type 2 diabetes. So like I said, my name's Rebecca Taylor. I'm a registered nutritionist with an undergraduate and a master's in personalised nutrition, particularly nutrition genetics, which we've spoken about in previous presentations, which some of you may have been on that one. So my background is working for multiple startups, helping them with product formulations and helping them with genetic panels. I now work as a consultant and as a freelance nutritionist, particularly helping individuals optimize their health, get to the root cause of health issues by looking at a personalized approach to their nutrition. So we look at their genetics, sometimes microbiome, and other markers like that. But I also have worked with type 2 diabetic patients in the past. In fact, I've actually gone to Fiji to work on type 2 diabetes education, which I'll just talk about shortly. So why is diabetes named the silent epidemic? Well, first of all, over 10% of the adult population has diabetes, with almost half being unaware that they actually have the condition. And this number is expected to more than double to 1.3 billion by 2050. So just let those numbers sink in for a moment. You can see that it is a huge global problem that we're facing, and it's not going anywhere. Unfortunately, it's set to increase even more rapidly as the years go on. So it's silent epidemic because, yes, half are unaware that they are living with it. So let's look at actually what is diabetes. Well, we have three different types really. We have type 1 diabetes, type 2 diabetes, and gestational diabetes. Like I said, we're going to be talking about type 2 diabetes predominantly. And this is the most common form of diabetes by far. This accounts for 90% of all diagnoses. So in this form of diabetes, we're going to be referring to that on the presentation as T and 2 and D, just so you know, that's how we reference it now from now on. So in this particular form, type 2 diabetes, that is when the body does not produce enough insulin that is needed, or that the cells ignore the insulin that is produced. So we need insulin. It's a hormone that the body creates in response to sugar uptake. It's required by the body in order to use that sugar for energy. Insulin takes that sugar from the blood into the cells. So it's basically like a lock and a key, and the insulin is the lock, and it opens up the cell to allow sugar to come into that cell to then be used for energy. But when we don't have enough insulin, or that insulin becomes non-responsive over time, glucose then builds up in the blood instead of going into the cells, and this can cause some problems. So in the short term, your cells may be starved for energy. So and then ongoingly, if it happens over the long term, high blood glucose can harm your eyes, kidneys, nerves, heart, just to name a few things, but there are many more issues that it can cause. And also to note that we will be talking mostly about the management side of it from a nutritional standpoint. I won't be going too much into the medication side of it because it's a big subject, and we could spend a lot of time talking about the medication side, and I don't really want to concentrate on that today because it's not really my specialty either. I'm a nutritionist. This is we want to look at how we can manage type 2 diabetes through lifestyle. So let's talk about some stats. Age-wise, the highest rate of type 2 diabetes is for people aged 65 and older. That accounts for 20%. So anyone over that age, 20% of them have diabetes. And the highest rate of it is in North Africa and in the Middle East at 9.3% of the population. It's more prevalent in women than in men. And like I mentioned earlier, 90% of all cases of diabetes are type 2 diabetes. So the key contributors to this major rise in type 2 diabetes include urbanization. So we know as a country becomes richer and it has more access to processed foods, fast foods, the higher the rate of diabetes. It's very much in sync. And an aging population, decreasing levels of physical activity, and increasing overweight and obesity prevalence. So like I said, I went to Fiji for a few months to help with their diabetes project out there. So they're really, unfortunately, suffering with a huge amount of diabetes cases, increasingly over the last few decades, because they have been experiencing a shift of food patterns. So they're now going away from eating their traditional diets to more eating a diet of processed foods, high convenience foods. A lot of the food that's produced on Fiji tends to get shipped out, all the fresh food, and they tend to now want to have a diet mostly based on these more convenience foods. And yeah, unfortunately, are stepping away from their more traditional type of eating. And this has, as well as coupled with the low amount of education at the moment for diabetes, unfortunately, this has created a high rise in diabetic cases. So now that 1 in 2 have diabetes or pre-diabetes. And we did tests, health checks, and yes, it was quite shocking the amount of people we were diagnosing with diabetes, and children as well. So we were doing education in schools because a lot of the families didn't know how much sugar was actually contained in, you can see the orange juice carton here on the table. They would give that to their children and not know, that maybe this wasn't the best choice for their breakfast sometimes, or strawberry jam, and we would show how much sugar was actually in each of these products visually so that they could really see it. So just to recap about the pathology of diabetes. So in a healthy person, we have insulin working as it should be. The glucose comes into the cell as it should do because the insulin receptor is responding to glucose normally. And we're able to use that energy, the sugar that's come into the cell, for energy. And then in type 1 diabetes, this is where the pancreas actually doesn't produce insulin at all, or not enough. So type 1 diabetics often have to take insulin medication into it through a medication through their arm or something. They usually take shots of that. And in type 2, we have where the cell doesn't respond to insulin properly. Or again, it's not creating enough. So just a bit about the hormone, which is insulin. So inside the pancreas, that's where insulin is produced. Beta cells make the hormone. And beta cells then release insulin to help the body use or store this blood glucose that is created from our food that we eat. And like I said, type 1 diabetics, the pancreas doesn't make insulin. Either that can be in childhood, or it can be onset in adulthood, but more likely that's going to be from childhood. And that's more of a congenital issue. It's more an issue that comes on, from earlier in life. So the beta cells have been destroyed, and insulin shots are the only way to keep your blood glucose levels down with type 1 diabetes. And then those with type 2, they do make insulin, but their bodies don't respond well to it because of those constant high blood sugar levels. But some people are able to manage this through diet and lifestyle, and they don't need to take any medications or insulin shots to help their bodies use glucose for energy. So in terms of populations, who's most at risk? It obviously is across the board. It does affect all ages and races, and increasingly we're seeing it much more in children now, unfortunately. But yeah, some groups definitely do have a higher risk for developing it. So African Americans, Latinos, Native Americans, Asian American, Pacific Islanders like Fijians, and the aged population as well. And there's some reasons for that, which we will talk about shortly, which is about my area of particular expertise of genetics. So risk factors and causes. Now, type 2 diabetes is known to be more linked to lifestyle factors and or being more lifestyle related than type 1, which is more autoimmune, or it can be more it's more something that you are born with. So with type 2 diabetes, some of these risk factors obviously do increase your likelihood of, or your risk of developing at some point. And that can include high calorie, low nutrient diets, so ultra processed foods, high sugar diet, of course, high diet high in saturated and trans fats, a sedentary lifestyle, obesity, and insulin resistance. And then in terms of the genetic aspect, we know that type 2 diabetes is linked to hundreds of genes. They think it's about 150 genes at the moment. But of course, we're having lots of research in this area all the time. So there's more genes emerging all the time, and these genes often work together. So there's sort of a loci it's called, where we have if we have one gene that you have the genetic component for that, you're more likely to have the genetic component for another one. So having said that, it's unlikely that someone is going to have the genes, the diabetes genes, we'll call them, for 150 of them. That's probably not going to be the case. So it might be that you have half of those that are positive, that are helping in terms of reducing your risk for diabetes, and then you might have the other half that are actually increasing your likelihood. So they can play against each other as well. So it's often that saying of genes load the gun, but lifestyle pulls the trigger. So with my genetic testing, I often see people do have, for example, we see a gene that controls someone's ability to use carbohydrates and sugars. And I know that for some people, their ability to utilize sugars is going to be different to another person's, and their risk of type 2 diabetes will be higher for some people because of those particular genes that we look at. So they're likely to uptake sugar a little bit more quickly into the body than others. And they might have an inability to sort of stabilize their blood sugars a little bit less than other people. So there certainly really is a genetic component to this. In fact, people with a close blood relative, whether that's a twin or a sibling, a parent, they're 2 to 6 times more likely to develop the disease. That's quite significant, really, I think. And if one identical twin has type 2 diabetes, there's up to a 75% chance that the other will also. Now, obviously, there are things to consider with that. They will share 100% of the same DNA, of course, but they also will have a very similar upbringing. So it would be interesting to know at what point that is, because their upbringing will be the same to a certain point. So a lot of those lifestyle factors will be quite similar if they're identical twins. And then we have environmental risk factors as well. Like I said, urbanization, that huge link between increase of a country's wealth and the increase of type 2 diabetes as well. And then often lack of access to healthy food is going to be a big risk factor too. So emerging risk factors, this is quite an interesting area to think about, is actually, aside from the lifestyle factors that we know and have been well researched and are quite established, and the genetic factors, there's some more other factors which are now coming a bit more mainstream, a bit more researched in these last, say, 10 years or so. So, for example, chronic stress is a really key one to think about when talking about type 2 diabetes. In fact, I know of some individuals who they've had a very healthy, healthy diet. Healthy depends on the person, but looking at their diet, it was good and they were sleeping well, they were exercising, but they were chronically stressed and they had type 2 diabetes. So it's certainly possible for an individual to have lots of things going for them, but actually, if they are chronically stressed, it's still very much possible for them to have issues with blood sugar regulation and therefore develop type 2 diabetes eventually. That's because cortisol, which is our stress hormone, when that is elevated in the long term, this causes us to not really be able to use blood sugar properly and correctly. It's also going to increase our appetite. It's going to basically cause our hormones to be a little bit out of whack and a bit all over the place and cause that blood sugar dysregulation. And then poor sleep quality, we know that very much impacts our glucose metabolism. I forget the stat now, something if you have something, a really bad night's sleep. It's not going to sound like a very good statistic. I can't remember the exact numbers, but the way that it impacts your calorie intake the next day is very dramatic. So I'm sorry, I don't have the stat there in front of me. I've just suddenly thought of it. But we know that it increases your hunger hormones and it's going to cause your blood sugar generally to be a lot higher. And then mental health. So anxiety and depression are very much associated, of course, with poor lifestyle choices, which are then going to increase your risk of developing type 2 diabetes. And then an area that I'm very interested in, gut microbiome. There's been some research on those with type 2 diabetes, and they've looked at their microbiome composition, and they found that those with a particular two strains of bacteria, which I'm going to try and pronounce, Coprococcus, which that if someone has that particular strain of bacteria, it's likely that they've got a higher insulin sensitivity. So that's a good thing. We want you to have higher insulin sensitivity. And if they have more of the Flavinicracter bacteria, unfortunately, the opposite is going to be true. So they're actually going to have that decreased insulin sensitivity and will be more likely to have irregular blood sugar levels. So that's definitely one therapeutic measure you could have for someone with type 2 diabetes or someone at risk of it. You could look at trying to increase their intake of a particular probiotic with that strain of bacteria in, the Coprococcus. And you could do a microbiome test to check if they have high levels of this bacteria called Flavinofactor. And you can look to try and reduce that level of bacteria, that bad bacteria, by increasing your intake of plant-based foods. And then inflammation as well. We know that chronically high blood sugar levels, they increase our inflammatory response. So this can be a bit of a vicious circle because unfortunately, if our blood sugar is always high, our inflammation is always going to be high, and it's going to be hard to get that level down. So, one thing you really want to do to get inflammation down is, of course, to try and control that blood sugar level. There's lots of other things you can do through diet as well, which we can talk about a little bit later. So what are some of the common signs and symptoms of diabetes? Well, you might be diagnosed with diabetes if you have any of these symptoms. So the more common ones, which I put on the right-hand side, include excessive thirst all the time, frequent urination, and just general fatigue and weakness. The less common symptoms would be extreme hunger, pins and needles, dry mouth, darker skin on the neck, a fruity smelling breath. That's due to the body's process of using ketones for energy rather than glucose, blurry vision, itchy skin, and slow healing wounds and increased skin infections. So I wonder if those were a surprise to any of you. The darker skin on the neck, that's particularly in those with a darker pigmented skin. So why is Alo detection really important? There's a few reasons for this. So high blood glucose levels are not only bad for our energy levels, bad for all the other type 2 diabetes in general, but actually that can really impact our risk of developing other heart issues. So heart-related complications, coronary heart disease, high blood pressure, all of these are related to high blood glucose levels. And kidney failure, so elevated blood sugar levels can damage the kidney's filtering system, so they could eventually lead to kidney failure, and so you might need dialysis or a kidney transplant, and this is not a good situation to be in at all. So vision loss, because high blood sugar levels impacts our nerves, it also impacts our eyesight. So high blood sugar levels damage tiny blood vessels in our retina, and they can cause us to have these vision problems. Actually, in Fiji, I was often seeing individuals with amputated limbs as well, unfortunately, which is very sad to see, because of chronically very high blood sugar levels. We had to take some people straight to the hospital because their blood sugar levels were almost not being read on our blood glucose monitor. It was off the scale. It was over 40. So if you are above 7 on that glucometer, you are diabetic. But yeah, some people were up over 40. So really quite sad to see. And obviously increasingly that's going to be an issue. We know those numbers are going to be massively increasing over the years. So what type of diet should you eat? Thankfully, the great news is with type 2 diabetes, it is one of the most manageable conditions you can have. So it's very much preventable and it's very much reversible with the right strategy. So that's why I love talking about it, because actually the power can really be in your hands here. And if you are worried yourself about maybe having type 2 diabetes or pre-diabetes, then please do send me any questions, and we talk about them at the end here, or send me an email. My email will be at the end. I'll be very happy to help you out at all if I can, although difficult to give any personalized advice, obviously without knowing your situation fully. But these are just some general tips that are going to be helpful for everyone. So of course, we really need to have focus on whole foods in their natural form as much as possible, that haven't had their natural state altered, or have fiber taken away, had additives put in. There's a few reasons for this. So we don't want the fiber to be taken away, because once the fiber is stripped away from foods, as they often are when they're processed, that's going to make the food be absorbed and metabolized by our body much more quickly, and it's going to cause our blood sugar levels to peak a lot more quickly. So the glycemic index of that food is going to be much lower, so it's going to spike our foods. We really want foods to have that high glycemic index. Sorry, I've got that around the right. Sorry, low glycemic index. So you want to look for low glycemic index foods. So the lower the score, the better. Every food is scored out of 100. So you can look up this information online and it can guide you to which are better choices for you. So vegetables, we particularly want to focus on non-starchy veg. So think of vegetables that are grown above the ground rather than below the ground. For example, leafy greens and broccoli, tomatoes and things. So as opposed to potatoes and more of those starchy vegetables like swede. I'm trying to think of other examples, but those are the main ones. And also low glycemic fruits, particularly berries. They are probably the best fruits for diabetics because they have the lowest glycemic index. And whole grains as well. Really want your diet to be made up quite substantially from whole grains. So oats have been shown to have a very blood balancing effect if they're paired with fats and protein. So ideally you don't want to be having these whole grains on their own, because they sometimes can cause a bit of a sugar spike or a blood sugar spike if they are just consumed on their own. But they are great options, and they're full of fiber and whole grain goodness, which is going to be great for our gut health as well. And then lean proteins, so try to go for ones that aren't so high in saturated fats. So red meat, try and reduce that as much as you can. So we want plant-based options that are low in, well, they have no saturated fat in them at all. Beans, lentils, tofu are all fantastic options. And salmon and mackerel, oily fish, we know that omega-3 is extremely important for many aspects of our health. For example, inflammation, helping control that. And lean meats like skinless poultry and lean beef is fine. So rather than going for yeah, higher fat beef, or if you get mince, try and go for turkey mince or lean beef with that's slightly reduced fat in them. And then as for healthy fats, try and go for more of the olive oils rather than rapeseed oil, or those more refined oils that we often see in our supermarkets. Now, olive oil definitely has gone up very much in price recently, so it is expensive option to get. So if that feels a bit out of budget, you could get something like a sunflower oil. It's not quite as refined as, say, rapeseed oil. It's a little bit less expensive. Avocado and nuts, we know these are excellent options for our health. And of course, trying to limit saturated and trans fats. Trans fats are generally in processed foods like crisps and chips, and anything that's in a packet usually has trans fats of some sort. And saturated fats are generally in animal fats, or saturated fat might be in a coconut oil, for example. So anything that's solid at room temperature means that it has more saturated fat than unsaturated fat. And then some more tips as well here. So obviously carbohydrate control is important for type 2 diabetes management. So try and choose those complex carbs, whole grains, legumes whenever you can, to base your meals off, or if you can base your meals off the non-starchy veg. In fact, I'll just show you quickly on the next slide. This is from the American Diabetes Association, the diabetes plate. So they actually say you want to base your meal 50% on non-starchy vegetables, basically an unlimited amount of non-starchy veg, and a quarter of your plate would come from carbohydrate foods from whole grains. So that they have got potato in there, so that could include potato, but just in a slightly smaller amount. And then you've got your protein foods, about a quarter. And then the thing I think is maybe missing from this is your fats. So I would definitely include some healthy fats on this, because we know that having healthy fats in your diet can actually help reduce your cholesterol, and it can help manage your blood sugar levels as well. Let's get back here. So with sugar as well, of course, we want to monitor this quite carefully, making sure you avoid sugary drinks in particular, because these do hit the bloodstream quite quickly because you don't have any fiber in them, particularly if you're having them on their own. They're going to have quite a hyperglycemic effect, causing that blood sugar to come up quite quickly and drop, which is really something you want to avoid, because that's going to cause that insulin to be released quite rapidly when that blood sugar spikes up quickly. So ideally, if you are going to have a sugary drink or a sugary snack, try and pair it with something that's high in fat and protein and fiber. So that's going to slow your digestion of that sugar down in your system, and it's going to blunt the spike. The natural sweeteners, so these are fine, you can use them in moderation. It's a question I get asked a lot about, but really you do want to be quite careful about not having too much reliance on sweeteners. This is because we know that they do have an impact on our gut microbiome, and they can have an impact on our hunger levels as well. So there is some research to indicate that if you have natural sweeteners, if you have any kind of sweetener that's not or an artificial sweetener or a natural sweetener, it can actually cause you to then have higher hunger levels because your body hasn't received the sugar that it's expecting. So it causes this kind of deficit almost, where your body's expecting to get sugar, but it doesn't. It's got the artificial sugar sweeteners which don't have any calories in, and then it can cause you to overeat more after that. And then we know drinking water is really important as well to keep our blood sugar down, and a regular eating schedule. So try and eat consistently as well at regular intervals. And also I would probably add just to that, thinking about it now, don't eat sort of too close to your bedtime as well, because if you eat too close to sleeping, it can impact your blood sugar levels a few hours later. So not the best idea. It can impact your sleep as well because of that. So let's talk about some technologies now that are coming out to help you manage type 2 diabetes. So we have these diabetes smartphone apps now, which are very convenient. I've trialed one out myself. So you just have your blood glucose monitor, your CGM, they're called, continued glucose monitor, it stands for. And you can just scan your phone to the monitor and it automatically tracks your current blood sugar levels. So you get real-time data of what's going on in your body. It's very interesting. For me, it was obviously, I don't have diabetes. It was more out of my own interest. I wanted to see how certain foods were affecting my blood sugar. And it was very convenient to be able to just get that real-time data from my phone. And we have meal delivery services as well, which particularly cater to type 2 diabetics. So they are portion controlled, carb controlled. So if you have the resources to be able to afford these kind of things, they are great, but they're not going to be accessible to everyone. Now, obviously, I haven't spoken about the medication side of these things and whether people want to, if they don't want to be on medications, and how they manage that through their lifestyle, which it is certainly possible, but it's something you have to talk to your doctor about. Personally, if that's something you want to, if you want to do yourself, because certainly depending on your blood sugar levels, it might be that you very much need to be on medication. And then, so in terms of sports and exercise, we really should be aiming for 150 minutes of moderate intensity exercise a week. So moderate intensity exercise includes things like walking, cycling, swimming, basically anything where you can still hold a conversation, but still be doing the exercise. And also, we know strength training is super important because we need to build muscle in order to improve our insulin sensitivity. So in order to uptake sugars properly, if we have a muscle to do that, it actually lowers our blood sugar response. And also, if you are struggling with obesity, with type 2 diabetes, by increasing your muscle mass, we're actually increasing your metabolic rate, and you're going to be burning more calories just simply by having that extra muscle on you. The muscle is actually a metabolically active tissue, so it's really one of the best things you can do if you are trying to lose weight. So myth versus reality. These are some common myths people have, and I'm going to debunk them about diabetes. So only overweight people get to type 2 diabetes. That is certainly not the case. So obesity is definitely a significant risk factor, if not one of the biggest risk factors. But many individuals with type 2 diabetes are not overweight, and I've seen that many times. Like I said, there can be so many other things going on: genetics, age, and diet, physical activity, and stress, sleep. All of these play crucial roles. It's never usually just one thing, it's often a combination of lots of things together. And then eating too much sugar directly causes diabetes. So yes, definitely consuming lots of sugar can lead to weight gain, which is a risk factor, like we just said. But the direct cause is a bit more complex than that. And it, of course, involves how the body processes and uses glucose. And type 2 diabetes is a mild form of diabetes. So compared with type 1, I would definitely say it's not true because there are so many complications to type 2 diabetes, such as limb amputation, heart disease, kidney damage, vision loss, and these can all be life-threatening as well. So we really need to make sure there's proper management to prevent it getting to that point. So with that, it concludes my presentation. I left quite a lot of time for questions today. I thought there might be quite a few people who wanted some specific or had some specific questions for me, because I believe this was a presentation you particularly wanted to talk about today. So please do let me know if there's anything and you had any burning questions about. I'd love to I'd love to answer them. And yeah, thank you so much. I will just stop sharing my screen 1 second so I can see the questions.
Thank you very, very much to you, Rebecca Taylor.
Thank you.